Hi, everybody. I am Dr. Handler with Mind and Mood Mental Health, located here in Omaha, Nebraska. I am a psychiatrist and I provide mental health services all over the state of Nebraska and Oklahoma as well. So, today I wanted to record part one of sleep and mental health. So, this is an important relationship. Getting poor sleep has a negative effect on your mental health, and having a lot of mental health disorders have an associated poor sleep component as well. So, it's an important topic, so I wanted to touch on it. So, as far as sleep goes, it's super important for your health, your immune system, your mental health, of course. There are tons of beneficial effects of a good night's sleep. Sleep disorders affects about 40% of the US adult population, but this number is all over the place if you look it up. But it's a pretty high comorbidity between mental health and sleep disorders. So most of us, will wake up groggy in the morning and we'll tell ourselves, tonight I'm going to get to bed early. I am not going to watch television, my favorite show, and instead I'm just going to go to bed instead. Then that evening rolls around and you're either not feeling so tired or you just have other things that you think are more valuable use of your time. So when it comes to sleep and your psychiatric appointment, that is something I always like to talk on during the first visit. I think it's important to know everyone's sleep patterns. How do you prepare for sleep? Are you having trouble getting to sleep? Are you waking up in the middle of the night and having trouble falling back to sleep? All of those are important and help me understand a little bit about what might be going on. So when we look at sleep, it has been studied quite a bit. And when we talk about REM sleep and non-REM sleep, those are phases of sleep. And for simplicity's sake, we're just going to leave it as a REM and non-REM. So REM is a time of sleep where you have quite a bit of brain activity, and it stands for rapid eye movement. And this is the time when you are dreaming. And if you wake up during REM sleep, you are more likely to remember your dreams quite vividly. Versus non-REM sleep, there is still some brain activity, but it's a little bit slower. So all night long, there are fluctuations in brain activity, but it is indeed a time of active activity of your brain. So either phase, we're looking at active time, and it's all important for improving sleep, improving memory, improving thinking and learning. And when we don't get good sleep, we notice that during the day, though we're not so sharp, we're not feeling like our memory is working so well. And if you ask parents of newborns, they describe it as a bit of a fog. They're in a daze during those early days with a baby. So, when it comes to sleep, if we're not getting good sleep, it has quite an effect on our emotions. We see worsening mood, irritability, mood swings, increase in depressive symptoms, anxiety. It can trigger bipolar disorder if you are at risk for that, and even psychotic symptoms too. So before our next discussion, when we're going to talk a lot about sleep hygiene and ways to improve sleep, I did want to touch on a diagnosis worth mentioning called obstructive sleep apnea, or OSA. So this is a health condition where while you're sleeping, you have pauses in your breathing. And during that time, you are not getting good oxygenation to your brain, and you're having fragmented sleep. Someone who shares a bed with someone who has obstructive sleep apnea may mention that that person almost chokes during different times of night, and that's them kind of gasping for breath. And so having untreated obstructive sleep apnea is definitely linked to mental health symptoms. In fact, one study found that anywhere between 24% and 58% of individuals with obstructive sleep apnea or another kind of breathing sleep disorder will meet the criteria for depression as well. So that is why it's super important that you meet with a specialist, you have a sleep study, And then, if diagnosed, you wear whatever device you are given to help you stay oxygenated during the night, whether that be a CPAP or another nighttime assistive device. So that will conclude today's discussion. For our next discussion, we will continue on talking about mental health and sleep hygiene as well. So again, I'm Dr. Handler with Mind and Mood Mental Health, and I hope to hear from some of you soon. Thank you.